This is Mountain Health Minutes. I'm your host, Ted Owens, and with me today is Dr. Brian Evans, Chief Medical Officer of the Tahoe Forest Health System. Dr. Evans, glad to have you here.
Thanks, Ted. Good to be here.
Dr. Evans, one of the things that I think confuses people, and maybe our younger folks in particular, you get older, you get a little bit more in tune with the health system, and that is the different levels of care. And I'm talking about the emergency room, urgent care, and primary care. All three are different for many reasons. Can you enlighten us a little further?
Yeah, I think it's important to think about, what's the best place to go if you're having an issue. And obviously, we want to make sure that people don't minimize their symptoms and end up going someplace where they really should have gone immediately to the emergency department. So let's talk about that one first. I think that some of the symptoms should seem obvious to people when people are having significant chest pain, for example, or abdominal pain, or let's say they've got severe vomiting. Those are all indications that you probably should go into the emergency department rather than try to call your doctor, etc. Other things I want to mention are signs of a stroke. So most people are aware of the acronym FAST, which stands for face, arms, speech, and time. So drooping of the face, difficulty moving the arms, difficulty speaking, and sort of a rapid onset, you want to deal with that quickly. So that's the time element. So signs of stroke, you really want to get to the ER as quickly as possible. Ideally, just call 911 in that situation. Also, I'll just mention confusion is something that happens commonly, and that's an ER type of presentation, or serious trauma, major fractures, etc. But a lot of these things don't need to be in the emergency department that are more minor things. So, you might consider calling your primary doctor if you've got something that's not particularly time sensitive. They're mild symptoms, especially if it's like a chronic management issue or screening tests, and it warrants more of a longer conversation with your primary doctor. Those kinds of things can generally wait. And then we've sort of got the in-between phase of care, which is the urgent care. And we have several urgent cares in the area. And they have x-ray, they can do some limited lab work, and they can do a good evaluation on things that are more time sensitive than a primary care visit, but not quite serious enough to be in the emergency department. So things like a urinary tract infection or respiratory infections, minor trauma, that kind of thing. Those are all good options to go to the urgent care.
And I understand the urgent care with the Tahoe Forest Health System you can make an appointment similar to making a reservation at a restaurant, right?
Yeah, we have On My Way, which is a great app that you can use to essentially schedule an appointment in the urgent care. And we have availability, and it works out very well for our patients.
Very good. Thank you, Dr. Evans. We've been talking about the differences between emergency care, urgent care, and primary care. This is Mountain Health Minutes. Thank you very much for tuning in.